I came home from church one day and I was undressing to put on my Sunday clothes, and I found this lump. We had a needle biopsy done, and within 2 days, I knew I had cancer. I was terrified, and I knew it was a battle of my life. I was in for the battle of my life. When you hear the word cancer, you become so isolated. It's almost like this thing grows around you, and you're inside of it, and there's nothing you can do.
As a practicing physician, I wanted to create a place that folks could go to that not only delivers great health information in a way that's understandable and useful, but also share inspirational stories to help us all grow. People think that once you're adults, you're done learning. You are not. In order to be successful, you have to have an open mind to learn. Real problems discussed in depth with real solutions. This is the Dr. Nandi Show. Hello and welcome to the Dr. Nandi Show. As a physician, I know there's nothing more devastating to my patients than receiving a cancer diagnosis. For many, they feel as if they've been given a death sentence. However, early screening and better treatment methods are saving many lives. That's why I wanted to talk about this very serious topic. I've assembled a group of experts specializing in various types of cancer to talk about early detection, treatment options, and survival rates. You don't want to miss this very important show. We'll be right back after this.
Your initial reaction is, I'm gonna die. And I didn't say that out loud because my kids were there.
But you thought it?
Of course I thought it, and they knew it. They could see it on their mama.
Welcome back. You're watching the Dr. Nandi Show. And you heard a little of Tammy Thompson's story at the beginning of our show. Now, she owes her life to early cancer detection. Now, Tammy joins me now. And Tammy, thank you so much. I appreciate it. Welcome to our show, and thanks for taking the time to share your story with us. So what happened? Tell us all about it. How did you discover that you had this cancer?
Well, one day on a Sunday, I came home from church with my family.
Yeah.
And I went upstairs to get into my play clothes. And as I was taking my dress off, I noticed there was this bump that was protruding. And I felt it like this a little bit. It was like almost like a golf ball. It was very unnatural. It didn't belong there, and it was just there suddenly.
On the right side of your breast?
Yeah.
Okay.
And so my husband came over and checked too, and we both agreed that it wasn't normal.
Did it hurt?
It did. It was sensitive. It's hard to describe. It just was so foreign.
It was just, you knew that it wasn't there before. And is that the first time you recognized it?
Yes.
And so never, and all of a sudden?
It was like just very sudden.
Did you examine yourself regularly before that time, or did you get mammograms? You always did. And you never found anything?
No.
Okay.
No.
And then go ahead. I'm sorry, you said after that, what happened?
Yeah, and well, I would like to add to that.
Sure.
I just think that is imperative. In fact, in my case, it saved my life.
Oh yeah, absolutely.
So it really did.
And so many people who are watching, I think, will have to really understand that. I had two members of my family, the same thing. It wasn't with the mammogram, it was with their examination that they found it. Mm-hmm. So then what happened? You guys knew it was abnormal and you went to see the doctor, or?
I did. I called my doctor's office the very next day, and he got me right in. And I saw him that afternoon, and then he had me already scheduled before I left his office to go see another doctor who was ultimately my surgeon, Dr. Eric Brown.
Yeah.
So.
And what did they do to find out what's going on? Maybe you can go through the process, because a lot of people don't know what you have to go through to get a diagnosis. Did you get a biopsy, or?
Well, my first doctor, Brian Torok, did an exam on me and, had validated that the bump wasn't normal. And so then when I went to Eric's, or Dr. Brown, and I call them by their first name because they're like my family.
Yeah. Yeah.
So anyway, I went to Dr. Brown's, and he did a needle biopsy that day. And within this same week, I knew he called me. And he told me. And I was with my kids at the time driving home from work. We were all in home care, and my kids were PTAs out in the field, and I was a director for a home care company. And we were all kind of waiting. And so my kids were there, and I don't think there's any irony in that.
Yeah.
You know?
And what did it make you feel when the first time you heard what the diagnosis was?
It's devastating. It's absolutely, I can't even begin to describe it to you, because everything in your world changes like that.
Stops almost.
It just does. It's so surreal. I didn't believe it until it all really started to happen, which was super fast, because my doctors just saved my life.
Yeah, you know, and when people were watching who've never gone through anything devastating like this, is that, you know, Dr. Brown, and this is why I practice medicine, is because you want to be there when, you know, patients' lives and their world stops, to be able to make an impact on their lives. It's amazing, and I know Dr. Brown is amazing, and we'll talk to him later, but you got the diagnosis, you're devastated, but then what did you do? You said you're going to fight this and beat it?
Well, like I said, I was with my kids in the car, and we started to talk about it. And of course, your initial reaction's fear.
Of course.
Your initial reaction is, I'm going to die. And I didn't say that out loud because my kids were there.
But you thought it.
Of course I thought it, and they knew it. They could see it on their mama. And so my son was driving, and you know, they weren't little kids. My son was 18 and my daughter was 20. And we cried. We felt it, and we cried, and we were scared. And then by the time we got home, my son was all revved up, and he said, we got to get our boots on, Mom. We've got to fight this. And that's what we did. We just, you know, we fought together. And they didn't leave my side. When I started to lose my hair, my son shaved his head.
Oh.
He held my hand through the whole thing.
Oh, that's awesome. You've got good kids.
I do.
We have to take a break. When we come back, we'll hear more about, you know, her story, but also meet her surgeon who gave Tammy a new lease on life. Please stay with us.
Being familiar with your breast, knowing when something's different or changing, can be the difference between life and death.
Welcome back. You're watching the Dr. Nandi Show, and I've been talking with Tammy Thompson, who discovered a cancerous lump in her breast during a self-exam. Now, we're joined also now by Tammy's surgeon, my good friend, Dr. Eric Brown. Thank you for coming on the show.
Thanks.
So appreciate it.
Appreciate it.
You know, and we were talking, Dr. Brown, about Tammy, and what do you think people who say, well, breast exams are useful, and some don't, maybe some don't agree, or what are the pros and cons of this?
It's undergone some scrutiny lately, self-breast examination, because if you ask women about their breast exam, they'll tell you that they don't know what they're feeling. Everything feels lumpy, and it can cause a little sense of panic in some. On the flip side to that is early detection. And when you develop a cancer in between your mammograms, we call that an interval breast cancer. They tend to be more aggressive, as was the case with Tammy. So being familiar with your breast, knowing when something's different or changing, can be the difference between life and death.
And I think you bring up a good point. I think people don't examine their breasts enough, are not familiar with what's abnormal. She knew right away that this thing there was completely not supposed to be there. So for those who are watching, you know, say, well, if you've never done a breast exam and you do it and you say everything feels lumpy the first time, but if you do it regularly, you know your breasts. And so I think that I would err on the side of, I would love to be able to have more women find it earlier. I think definitely, you know, what do you do to encourage women to detect, you know, cancer early? How do you convince them to do these exams? And what can you tell folks who are listening and watching that you should do? Because this cancer can be deadly.
It can. Breast cancer is curable nowadays, and our cure rates are the highest that they've ever been. And that has to do with early detection.
Correct.
So the mammograms, the self-examination, being aware of the changes that are taking place that are outside of what you would normally see. As you mentioned, being familiar with what's normal for you, so when something deviates from that, you can address it. You can cure cancer when you find it larger. You can cure cancer easier when you find it smaller.
Got it. And then the key is, to me, is to be your own health advocate, be your own health hero. And nobody's going to do it for you. And we can talk until we're blue in the face, but you've got to make those steps in your life to make that happen. And that includes, of course, everything we talked about, self-examinations, mammograms, but also let's talk about your lifestyles. How do you eat? Do you exercise or move every day? Do you keep a healthy weight? All these things have to be put into play, because every one of those things are playing an important role. And Tammy, I know we talked about you finding this. What advice would you give, knowing that this exam saved your life? What advice would you give to women that are out there saying, you know what, I'm not sure I need to do this?
I would say a lot of the same things you just got done saying. It's our lifestyle, but don't be afraid to know your body. Get to know your body. Know everything about your body. You're the only one that is going to take care of it, just like you said. I am my own advocate. No one's going to take care of me better than me. Yeah. So, great doctors, getting to know yourself, good food, exercise, staying engaged, all of that.
And what about Dr. Brown? There are people that come to me and say, I still don't want to know. The people have actually come to me and said, if I find out, just let me go. And I think those are misconceptions based on old information, old data, and you spoke about that. But I tell people that are watching, it's not the case. If you do find it, you can do something about it and live a fulfilled life. Would you agree with that?
Completely. And when you find something that is cancerous and requires treatment, of course, everybody's mind goes to something they saw on TV or in the movies, and they're on TV and in the movies for a reason.
Right.
The reality is that people can go through treatment, even to the extent of chemotherapy and radiation, and maintain a full, active life. They can work. The changes that take place in the body are not nearly what they used to be. And so it's something certainly that's understandably scary to people, but with some knowledge, you'll realize that it doesn't have to quite be as scary.
Maybe you can give us some guidance on when women should have mammograms and maybe how often.
Yeah, that's a great question, and it's a topic for a show. I mean, it is, the American Cancer Society recommendation is to begin screening mammogram at age 50. That's different than what it used to be.
Right.
I have a lot of patients that are in their 40s. So the breast surgical community really is erring more towards starting annual mammograms at age 40.
Absolutely.
Our fear is that eventually insurance companies are going to stop paying for mammograms in between the ages of 40 and 50. They make a qualification that if you're at high risk, you could maybe start your screening earlier. Well, most of my patients have no family history,
correct,
so by definition are not high risk.
Right.
So what do we say to them? So the data is mortality began to decline when screening mammograms started at age 40. I'm not exactly sure why we're messing with that.
Yes.
Because we're doing better. We're finding things earlier, more curable, less treatment, better quality of life. It just makes sense to me, and my recommendation is to start at age 40 and do it every year from then on.
You said it well. Mortality started to decrease when you started screening at age 40. No reason to mess with it. So if you're watching, that's what we would recommend. So thank you both for that, and it really would help. I think it's going to help a lot of people that are watching and hopefully save some lives, So I appreciate that. Just ahead, I'll talk with another member of Tammy's medical team about another form of cancer in women. Please stay with us.
Cervical cancer is caused by exposure and infection by the human papillomavirus. We feel there's over 150 strains of this virus, and we've identified at least 12 that are primarily cause most of the cervical cancers.
Welcome back. You're watching the Dr. Nandi Show. Today we're talking about the importance of early detection in the efforts to stop cancer dead in its tracks. In fact, there's encouraging news on that front. The American Cancer Society says that cancer death rates have fallen 23% over the past 25 years. So that's great news. One of the easiest cancers to prevent with regular screenings is cervical cancer. And my colleague and friend, Dr. Brian Torok, is an OBGYN, and he's here to tell us more. Dr. Torok, thank you so much. Hey, I'm doing very well, thank you. So, what type of screenings should women get to prevent cervical cancer? Because I think it can be preventable.
Yeah, and I think the great news for women in cancer in general, as far as bringing those rates down, is that cervical cancer, our screening protocols are extremely effective. Over the past 30 years, we've decreased the rate of cervical cancer by 50%. Awesome. And the reason why is, we can pick up changes very early. Those changes that we do pick up that are abnormal, they progress to cancer very, very slowly, sometimes over 10 to 20 years, and that we can treat those early changes very effectively. So what we do is, the primary screening method we have is a pap smear, and that's when you take cervical cells from a patient and you analyze those cells to see if there's changes that occur. The current guidelines say that for a woman aged 21 to 29, you can do that screening every 3 years.
Okay. There's
additional testing that can be done. When you look for viral particles, it's called the high-risk HPV virus, and you can analyze the same sample that a pap smear is done with, and you can actually see if these viral particles are present. And if we see the presence of that HPV virus, that means that that patient is at a higher risk to develop issues down the line or may currently have issues. So the guidelines say that then from ages 30 to 65, you can do a pap smear every 3 years, or this test, when you incorporate the HPV testing along with the pap, is so powerful that that test can be done every 5 years.
That's great.
And that's actually better than doing a pap only every 3.
That's awesome. So, we have great techniques the doctor's telling you about that can really prevent it. So make sure you get your pap smear and talk to your doctor about, if you're at higher risk and if you need to do it more. But I think every 3 or 5 years is awesome. We have a question from New York. Dorothy writes, says, who is most at risk for developing cervical cancer? So who is increased risk of cervical cancer in our patient population?
So cervical cancer is caused by exposure and infection by the human papilloma virus. We feel there's over 150 strains of this virus, and we've identified at least 12 that are primarily cause most of the cervical cancers. When you get infected by that virus, and 40% of the country at some point in their lifetime will get infected by one of these high-risk viruses, usually the infection is very transient and it goes away within about a year or two. What we worry about is somebody that's not able to clear that infection. So the risk factors are people that don't get screened.
Yes.
50% of cervical cancers occur in women that have never been screened or have had inadequate screening, and an additional 10% occur in women that haven't had screening in the past 5 years. So that's the biggest risk factor, but also if you're immunocompromised or you have HIV, you can't fight off the infection, so that puts you at a higher risk. If you've had multiple exposures to this virus through your activity, either through multiple partners or early age at onset of activity, can put you at a higher risk. And then also your family history. If your mom or your sister has had cervical cancer, you're 2 to 3 times more likely to get it. Women that have had more than 3 children or have had a child before the age of 17 are at a higher risk. And then also the birth control pill has been shown to cause an increased elevation of cervical cancer, but once you stop that, that risk goes down.
And does it go back to normal? So birth control pills, if you stop it, does the risk go back to normal after a certain period of time?
Yes.
Okay, very good. And so you're seeing that if you want to be your own health hero, you want to take action. So just ignoring the problem, saying that if it ain't broke, don't fix it, doesn't work in this situation, and you have to be proactive. What about lifestyle changes? What lifestyle changes can women do, except for, of course, go to your doctor, get the screenings? What else can we ask women to do?
Well, so if you don't get the HPV infection, you will most likely not get cervical cancer.
Sure.
So we've got a vaccine that's available now, and it's effective against the 9 most common types of the high-risk HPV virus. And this is currently recommended for all young men and women aged 9 to 26. So if this vaccine is given, the patients will never get infected, and if they don't get infected, they can't get cancer. And also, for the boys especially, they can't pass that infection on to someone else or a partner.
That's exactly right.
That's the biggest lifestyle adjustment we can make, is to make sure we're vaccinating our youth with this. And the optimal age to do that, by the way, is at age 12.
Yeah, and here's the thing, and you get this too. They say, well, little Johnny, or little, whatever, Sue or Rebecca, they're good kids. They don't need the HPV vaccination. I mean, I get this question when I talk about it in the news or I talk to my patients about it. They have the preconceived notions. I'm talking about parents who are watching that their kids shouldn't get it because they're too young. And the idea is it's the vaccine. You want to get that before they're sexually active, so you
Yes.
prevent it, not after they've acquired the virus. It's a real big misconception that you get the infection and then you give the vaccination. Not true. You want to give it when we think that we give it early enough before they become sexually active. And we could speak to that if people have misconceptions that come to you with the same problems.
Yeah.
Yeah.
Exactly what we tell them. And in addition to the vaccine, though, smoking, that causes a 2 times increased risk of getting cervical cancer throughout your lifetime. So stopping smoking is a big thing that you can adjust your lifestyle with. Also, exposure to sexually transmitted diseases increases your risk of getting cervical cancer. So just being careful with your practices.
Responsible.
Yeah.
And just be responsible. And the other thing is that for men, they have other cancers you can get with HPV as well. So remember, a lot of my parents that they're being asked to vaccinate their kids and their sons, they don't realize the other cancers. They go, well, my son's not going to get a cervical cancer, but they can get other types of cancer, oral cancers, and they can also get cancers in their penis and other parts of their body. So you have to remember that this is not just something that is only for women. We're talking about cervical cancer here, but for the men, you want to make sure you cover the whole gamut. Thank you so much. Amazing information as always. Always good to see you. This is a great guy, and he takes care of our family too. So up next, a rare form of cancer that can be prevented through healthy lifestyles. Stay right with us.
What happens is that gastric juices are digestive juices, and the esophagus isn't really designed to withstand that. The stomach is. So if you have digestive juices that are backwashing into the esophagus, then you can get irritation to the lining. And if you have continued irritation day in and day out, year over year, that irritation can then cause changes that leads to cancer.
You're back and watching the Dr. Nandi Show. And today's show, I'm giving you solid information on preventing and treating certain cancers. As a gastroenterologist, I see patients who may be at greater risk for developing esophageal cancer. Here to answer some often asked questions is thoracic surgeon Dr. Andrew Chang from the University of Michigan. Dr. Chang, thank you for joining us.
Thank you, Dr. Nandi.
I appreciate it and love your expertise. Dr. Chang is probably one of the world's best at treating this disease, so we're really lucky to have you here today. Tell, for our viewers, exactly what is esophageal cancer? People have never heard of it before. Can you give us an explanation?
Sure. So esophageal cancer is a cancer of our gullet, of the swallowing tube. So it's a muscular tube that runs from the mouth down to the stomach. A lot of times you don't even know it's there except when you have a problem with it.
Exactly. It's when you put food in your mouth, then it has to get in your stomach. That's the food tube that goes in. And when people get esophageal cancer, are you seeing an increased rate of esophageal cancer at least in this country?
So in this country, esophageal cancer it's sort of plateaued, maybe starting to come down a little bit, but what's increasing is the different types of esophageal cancer.
Yeah, and tell us about that.
Sure. There are basically 2 types of cancer. There's one called squamous cell cancer, and this is just how they look under the microscope, and that's probably the most common worldwide. But in the United States, there's a different type called adenocarcinoma,
Sure.
which has become more and more common.
And adenocarcinoma and that comes from often a disease called gastroesophageal reflux disease, which can lead to Barrett's esophagus. Maybe you can tell the viewers a little bit about that. People who've seen the show before, we've talked about GERD or GERD or gastroesophageal reflux disease. How does that increase the risk of adenocarcinoma?
Well, we think it does it because what happens is that the gastric juices are digestive juices, and the esophagus isn't really designed to withstand that. The stomach is. So if you have digestive juices that are backwashing into the esophagus, then you can get irritation to the lining, and if you have continued irritation day in and day out, year over year, that irritation can then cause changes that leads to cancer.
Yeah, and that change is often people talk about. It's called Barrett's, B-A-R-R-E-T-T-S. So Barrett's esophagus. And are there screening tests that can? So people are saying, "Gosh, I don't even know if I have it." Are there screening tests to find these types of cancers, Dr. Chang?
It's a tough thing because, fortunately, esophageal cancer is relatively uncommon. There's only about between 15 and 16,000 cases per year that are diagnosed. And gastroesophageal reflux, so many people have gastroesophageal reflux that it's hard to do any particular screening because of the rarity of the cancer. But if people have starting to have difficulty with swallowing, then we recommend getting a scope and endoscopy where you put a lighted camera down through the mouth to take a look at the esophagus.
Yeah, and the difficult thing and why we're talking about this with Dr. Chang is that often people with esophageal cancer don't have any symptoms until it's really quite advanced. So by the time you have trouble swallowing, just kind of imagine this, there's a hollow tube, and that tube has to be somewhat blocked for people to have any trouble swallowing. So that's when, people come in. But what I would also say is people who have reflux disease and who have gastroesophageal reflux disease and heartburn several times a week, and it's happening for a while, see your doctor to see if you need to have an endoscopy. And he's absolutely right. There are not a million cases of this. There's, relatively rare cancer. But the problem is that when you get it, it's very deadly. So we'd like to be able to have people who are at higher risk, people who are getting chronic reflux symptoms, to get screened by people like us who do endoscopy, which is, as he talked about, a little lighted scope, probably half the size of my little finger, goes in the mouth. It takes about 10 or 15 minutes, and often you're asleep for it. So I think that that'd be great. So besides doing those screening tests, Dr. Chang, what else can people do to reduce their risk of this cancer?
There are anything you can do to reduce gastroesophageal reflux. Avoiding late night meals, stopping smoking, decreasing alcohol intake. But really it's working on weight reduction, because weight reduction or obesity is associated with more gastroesophageal reflux. So even regular exercise, all these good healthy habits that we're all asked to do,
right.
It's so hard to do, it's really the best thing you can do to try to minimize your reflux.
You do amazing research. This gentleman has a huge brain. What kind of research do you do, and maybe you can talk a little bit about that?
Sure. First of all, you're too kind, but
you do have a big brain, though. It's been confirmed.
So do you. But I think the problem is because all cancers are very difficult to detect, and there's blood tests that exist for some cancers, but not yet for esophageal cancer. What our group is working on, trying to find something, what's called a liquid biopsy, where we can identify what changes are happening in esophageal cancer, whether it's a molecular change, a protein that's increased in expression, or something else. And if we can detect that protein in the bloodstream, then maybe we can push those patients towards getting a more invasive study like a scope to check it out.
That's awesome. Thank you for your dedication and the time and all
Thank
the
you.
research. It's going to save so many lives. I appreciate you coming on.
Glad to be
I know
here.
you're very busy, and taking the time to talk to patients, hope will save some lives.
Thank you, sir.
Of course. Coming up next, a frank conversation about one of the most deadliest of cancers. We'll be right back after this. Please stay with us.
Well, colon cancer actually is theoretically 100% preventable. And it's probably the only cancer that is like that in the U.S. and across the world, mainly because we have a wonderful screening test for it.
Welcome back. You're watching the Dr. Nandi Show. In my practice, I diagnose and treat patients who have issues with their digestive tract, which includes the stomach, gallbladder, liver, pancreas, and colon. Now, colon cancer is one of the most deadliest forms of cancer, yet it's also one of the most preventable. Here to help sort it all out for us is colorectal surgeon Dr. Amir Damadi. Dr. Damadi, thank you for taking the time and joining us.
That's my pleasure. Thanks for asking me.
Of course. And so a lot of people, when they talk about colon cancer, they go, doctor, that's an exit only. Don't want anybody to go near there. But what do you say to those people?
What I say to them is vigilance pays off. Even in those areas that you're the most uncomfortable with, you want to check that area out if there is something wrong. Because if there's something wrong there, imagine when you say exit only, imagine when that exit is broken.
Yeah. You can't, and their whole body can break down, and we know it's the third leading cause of cancer death. So clearly things happen. And what is, tell me about the importance of screening in the sense that how we can save lives and how preventable colon cancer is.
Well, colon cancer actually is theoretically 100% preventable. And it's probably the only cancer that is like that in the U.S. and across the world, mainly because we have a wonderful screening test for it. And by that I mean screening colonoscopies. There are other screening tools available as well, but the colonoscopy still is considered the gold standard, mainly because it diagnoses and also treats at the same time. So that is the gold standard. Then there are other tests if you're completely uncomfortable with that, but if you have a screening colonoscopy, the chances are you're not going to get colon cancer.
That's exactly right, and I'm glad you brought that out. And it's something very important he's bringing up, is that the gold standard is a colonoscopy. It's literally, you know, 1 day out of your life, if a 20 to 30 minute test, and most of the time you're sedated so you don't feel anything. And what he means by diagnosis and treatment is that you find these little tiny things called polyps, or the small growths in your colon that you don't feel. A lot of people come to me and say, well, if it's not broken, why do you want to fix it? The problem is that you don't have any symptoms from colon cancer or even polyps. And so until it's often too late, by the time there's blockage, only time you feel any symptoms is when the colon's completely blocked. Imagine a hollow tube, right? When something blocks it, that's when you feel any pressure, bloating, changes in your bowel movements. Otherwise, you don't feel anything. So it can be broken, and you just don't know it, and you can actually fix it. Dr. Damadi, we have a question from an online community member. Anthony from Windsor, Ontario wants to know, at what age should you start getting a colonoscopy, and how often?
Okay. It's a very good question. The main thing you have to think about is if you are having no other risk factors, meaning you don't have a genetic background of colon cancer, you don't have a family history of colon cancer, the screening guidelines currently recommend you to start at age 50.
Right.
And that means a screening colonoscopy. Now, if you have risk factors, meaning you have family history of colon cancer, and by that I mean direct family members, mom, dad, sister, brother, have had colon cancer, that may shift it to an earlier age. And mainly if their colon cancer is below 60, then it's 10 years below the age where they were diagnosed. So if your sister has colon cancer at 55, you should start your screening at 45.
Got it, got it. And very importantly, African Americans, you know, that we forget sometimes, at least in this community and many other communities in the U.S., you know, the screening rates for African Americans are lower than other populations. And the fact is that you should start at 45 for African Americans, 45 years of age, actually earlier than other populations because of an increased risk. So 50 for everybody else, as he talked about, if you have a family history, direct, so first degree, mother, father, sister, brother, that type of family history. And if you're African American, age 45. If you have a disease like Crohn's disease or ulcerative colitis called inflammatory bowel disease, that may put you at an increased risk. So inflammatory conditions, when your colon's always inflamed, that can increase the chance of colon cancer as well. So you should talk about this. And I alluded to this before, Dr. Damadi, but what are the warning signs? People are wondering, well, I'm not sure this has anything to do with colon cancer. What are the warning signs you want to tell our viewers about?
Well, the main signs and symptoms for colon cancer, remember this doesn't happen until it's late. It's
Correct.
Until you've had cancer. So you don't want to necessarily see these signs. But the signs are bleeding, rectal bleeding, or seeing blood in your stool. That's probably the number one sign. The second thing is abdominal pain or changes in your bowels. If your bowels suddenly go from once a day to once every 3-4 days and it's becoming pencil thin or thinner, you have to actually consult somebody to make sure there's nothing bad happening. Now, does everybody that have colon cancer? Absolutely not. But again, this goes back to the vigilance we talked about. Don't sit there and just assume it's nothing. Assume it's something and let me prove that it's nothing.
Correct. The value of a negative test is so important. I'm glad you mentioned that. People think, well, it was a waste of my time because you didn't find anything. I disagree so strongly. The value of a negative test is immense because you know now that you don't have a problem. You can wait 10 years and not have to worry about the fact that something is growing. Now, I don't want you to think that all colonoscopy is 100%, that you can still have some false negatives, meaning that there could be something small that could be missed. So if you have, let's say you have a colonoscopy 7 years ago and you're having symptoms now, it doesn't mean that something couldn't develop, but chances are you're not. Dr. Damadi, thank you so much.
Pleasure.
Amazing informational pleasure.
Thank you.
Pleasure's all mine. Thank you. Coming up next, we'll talk about one of the most common types of cancer. That coming up. Please don't go away.
Melanoma is one type of skin cancer, and it is the deadliest form, as you mentioned, and it is really a very preventable type of skin cancer.
Hi there, you're watching the Dr. Nandi Show, and today we're answering your questions about the different types of cancers. The most common form of cancer is skin cancer, but the encouraging news about one of the skin cancers, which is the most deadliest, melanoma, is that it's 100% treatable and preventable. I've invited my colleague, dermatologist Wendy Sadoff, who's also my dermatologist, to the show to give us the facts. Dr. Sadoff, welcome again.
Nice to be here.
Yeah, thanks for coming back again. So, let people know what is melanoma and what can they do to prevent it?
Melanoma is one type of skin cancer, and it is the deadliest form, as you mentioned, and it is really a very preventable type of skin cancer. So it's estimated that in 2018, we're going to have about 180,000 new cases of melanoma. And this is one that, I mean, with the body being, skin on the body being visible and you can see the cancers, it's different than it's an internal organ, so you can have your exam, just look at your skin, and that's the best thing that you can do in terms of noticing any changes in your moles or any new lesions, things that look different. So we really encourage people to look at their skin on a regular basis, maybe monthly, and notice if things are changing or if something is appearing or behaving different from the rest.
And really knowing your baseline. I want to go back to something she said. I mean, the number of cases that she talked about would fill, we're in Detroit, so we have a place called Ford Field. It would probably fill 3 of those stadiums. That would be the number of people that they're getting this. So it's not a small number. Serious problem that I think we can prevent. And the idea is that know what's normal so that you can know what's abnormal. And go to an expert like Dr. Sadoff that can help you to understand, first of all, how to examine your skin and get an examination by her. How important is it for folks out there to get an examination by you? I got one. It was painless, and we actually showed it on television. And pretty easy, right? And why should people do that?
People think it's a more involved thing. They think a skin screening, it's going to be very involved. It can last even 5 minutes or sometimes even less. It's a very quick visual exam aided by an instrument, a handheld instrument called a dermatoscope. And it's a way of giving you a baseline. And there's a lot of education that occurs during that exam. I can point out things that you may not have noticed. I can give you suggestions for, watching your skin, or I can point out areas where you may not have realized you've had more sun exposure than you think. Some people are surprised that red blotches on their neck or chest are really the cumulative expression of all the sun they've had from the time they were a kid on. And it's the time I can really talk about avoiding behaviors that result in increased risk of melanoma. So it's really good to watch your skin, but really change the behaviors that lead to these changing moles also.
What are some of the common things that we can do to prevent skin cancer and melanoma?
Be really aware of the amount of sunlight you're getting.
Yeah.
So about 95% of your risk is really due to the sun you're getting,
Absolutely.
Either outside or from the tanning beds. So obviously I'm really opposed to going into the tanning beds. We're seeing an increase in the incidence of melanoma related to that.
Really?
And so just a needless increase of your risk. But wear sunscreen, hats, sunglasses, be aware of the time you're outside, and also realize that you're getting ultraviolet light even when it's cloudy, even when you're driving.
So let's say you do everything you can, you still get a cancer. Is all hope, lost? If you get a melanoma, is it treatable?
It's highly treatable. So the best news is if it's a thin melanoma, if it's a very, very early lesion, because then you're talking 99% curable. And with a very minor excision, you'll just have local anesthesia, cut a little normal skin around the lesion, few stitches. It's one of the easiest, quickest treatments that, and then to be able to result in a 99% cure rate, it's incredible.
But I want to speak about people that are dark skinned like me. I've got a lot of African American patients say, this is not my concern. absolutely wrong, right? You can still be African American or dark-skinned folks like me and get melanoma, right?
It's actually more deadly, usually in a darker skinned individual. You know, we emphasize a lot light skin, light eyes, but it's really everyone.
Exactly. And soles of your feet, can you imagine that? So all of you folks who are more like me or darker skin cannot ignore this advice, cannot ignore it. Always fabulous and always great information. Thank you for coming on.
Thank you.
Of course. We'll be right back to wrap up what we've learned today with Partha's Prescriptions. Please stay with us. Welcome back. You've been watching the Dr. Nandi Show, and I hope you've received some insight from today's show about the prevention and treatments of many forms of cancer. Here's what we can take away in today's Partha's Prescriptions. Remember that all cancers come with different risk factors and symptoms, but a healthy lifestyle can help lower your risk for many forms of cancer. So please exercise, eat right, stop smoking, and maintain a healthy weight. Early detection is key to surviving many types of cancer. Screenings such as pap smears, colonoscopies, and mammograms can catch cancer at its earliest stages and increase survival rates. The most common form of cancer is skin cancer, but it's also one of the most preventable and treatable. Reduce your exposure to the sun by wearing sunscreen, sunglasses, and UV protective clothing. And finally, know your body and look for any changes that might signal a problem. See your doctor for the appropriate tests and treatment. To stay informed about today's topic, learn about healthy living and how to become your own health hero, visit me at AskDrNandi.com. Also, I'd love to hear from you. Be sure to search Facebook, Twitter, and Pinterest for Partha Nandi MD and join our discussion. And lastly, there's a beautiful word in the Hindi language. It literally means the light in me honors the light in you. And that word is namaste. So namaste to each and every one of you. I thank you for watching, and I will see you next time.